Here's a paper that was just released. Prevalence of Optimal Metabolic Health in American Adults, November 27th, 2018. This is a very scary paper. Why? Because it talks about cardiometabolic risk factor identification, or basically, how healthy is the American public? Well, what do they mean by metabolic health? They looked at 5 risk factors. Number one, what's your waist measurement? WC, waist circumference. For men, it should be under 40. For women, under 34 and a half. The next thing was blood pressure. Your systolic, the higher number, should be under 120. The diastolic, the lower number, should be under 80. What's your glucose measurement? Your blood sugar measurement. Get a blood sugar monitor. Measure it every morning. It should be under 100. Make sure your doctor runs something called a hemoglobin A1C when they do your annual blood work. That number should be under 5.7. They should also run on your blood work something called triglycerides. That's the fat. That number should be under 150. And then your HDLC, that number should be greater than 40 to 50. So taking all those numbers together, here is the scariest of numbers, the results. The prevalence, 12.2% meet those guidelines. Only 27 million Americans out of the over 300 million Americans meet those guidelines. As a healthcare professional, as a human being, that is very scary. Your lifestyle choices matter. Eat real food. No processed, refined food. Not a little. No processed or refined food. Get it out of your diet. So important. Get your rear end out of that chair and start to exercise. Whatever type of exercise makes you happy. Tai Chi, yoga, big heavy weightlifting, rowing, running, you name it, just do it. Got to change your lifestyle, folks. These numbers are very scary.